Yeah, canal wall down, canal wall up. And after doing a mastoid cavity, see the anterior wall of the mastoid cavity, inferiorly mastoid tip, posteriorly sigmoid sinus plate, and superiorly dural plate. Here, superiorly your brain will be there, right? Okay. Posteriorly, here your sigmoid sinus will be running like this, right? Okay, sigmoid sinus will be running. So here the in the picture you can see a part of the posterior bony plate is removed to show you the underlying sigmoid sinus here, right? And this is the dural plate. The junction of the dural plate means tegment, that is partition between the brain cranium and as well as your mastoid part. This is tegment or dural plate, and posteriorly is the sinus plate. This bony plate is dividing the mastoid cavity from the sigmoid sinus, posterior cranial fossa. Okay, so this the junction between the dural plate and the sinus plate is called as sinodural angle or Citelli angle. This was asked once. That's why I have kept this topic. Okay. So what is Citelli angle? After the mastoidectomy, you will be having a superior dural plate that separates from the brain. Posteriorly, you will having a sinus plate that separates from the sigmoid sinus, and this is mastoid tip, and this is anterior wall. Here your external auditory canal, this is posterior meatal wall. Okay, so this angle is called as Citelli angle or sinodural angle. Just remember this point. This question was asked once previously.